just can't believe, like, I can't believe I'm getting this. I can't believe it's happening to me.
So, the main question that we always get asked is about pulsatile. I'm not sure if you say it this way, but we call it pulsatile tinnitus. So, can you briefly explain to people what that is and how they can manage it?
I do want to say one thing. Dr. Crystal has an additional certification to deal with our tinnitus patients. We want to just touch on that.
Amazing.
So I've been working with tinnitus patients for about 10 years, strictly just for tinnitus patients within my total career. And I have a certification for tinnitus management, and it does some very intense courses. So I see a lot. I see the bulk of our tinnitus patients here. Yeah. So
Amazing.
So, so the pulsatile tinnitus, it can be a number of cause that. I oftentimes refer back to the ENT because we have to evaluate to see if there's something pressing on a certain area, if it's a globus tumor, and make sure that those things are clear before we even talk about any like retraining therapy or anything like that. Making sure that blood pressure is, yes, blood pressure. That's kind of a red flag one. Yeah. There's all kinds of tinnitus, but when we hear pulsatile, even our front office staff is trained to, ask certain questions, maybe have them go to a physician to make sure their blood pressure is okay and all these other things before they deal with the actual tinnitus portion with us. Absolutely.
So that's actually a really good point. Can you explain to people the difference between what you would class as regular tinnitus and then pulsatile tinnitus?
Tinnitus is the umbrella term for any sound in your head or ears. It could be ringing, it could be buzzing, cicadas or crickets, it could be whooshing, crackling, bacon sizzling. The most common one seems to be more of a high-pitched ringing. People use like tinnitus, and obviously some people call it tinnitus. We were trained with the term tinnitus, but we are fine with hearing the word tinnitus because it's so common. It takes a long time to make the English language. But specifically with pulsatile, that's when it could be like, anytime there's any form of tinnitus, we want to make sure that there's nothing else, we would say like retrocochlear or past the cochlea, past the inner ear, such as a brain tumor or something else going on. If we see an asymmetry or a difference, obviously one of the first things we're going to do is a hearing test. And let's say somebody has, I'll give you a perfect example. I had not one but two patients come in here for earwax removal, believe it or not. They thought they had earwax like plugged in one of their ears. First thing we do is look at the ears, no earwax. The way we have our clinic set up is that we're not going to just be like, well, you have no earwax, how did I say? Yeah, no, you came in here for a reason. So for the fee that we would have charged for the earwax removal, we're going to do a diagnostic hearing exam instead. And so in these two instances, we did an exam, and one ear, the non-affected ear was fine. The other ear had up to a profound high-frequency hearing loss. And that asymmetry or difference between ears is a very big red flag when combined. It's a big red flag no matter what. And then you add tinnitus to that and, a few other things. So the very next thing we're going to recommend is the patient go get some form of imaging done on the brain. And both times they did have an acoustic neuroma.
Wow.
So, benign tremor that lays close to the eighth nerve of hearing there. And, sometimes they watch it if it's small. Sometimes they take it out. When they take it out, a lot of times the patient loses the hearing on that side. But all of this just came about from, not like having ringing in the ears and things like that. But it's not like, I don't want to scare anybody who has tinnitus to always think that there's a tumor in your head. But you have to just kind of rule things out and make sure there's nothing else going on. It doesn't hurt to get a scan and just rule it out, and then that way you can deal with it. Okay, I'm just
So that's really interesting, because that worries me slightly, because especially here in the UK, people come to me because they're really struggling on getting appointments within our healthcare system. Our healthcare system is really, really struggling at the minute, and that really worries me. So that's sort of where I come in as the middleman, but I refer them to ENT, and they're waiting on lists for that in some cases. So that then big red flags get even bigger in those situations. So if it's a non-red flag tinnitus, is there any sort of coping mechanisms that you can give people to help deal with it? Because a lot of people I'm noticing have huge mental health impacts when it comes to tinnitus too.
It's a cycle, because a lot of them have issues with anxiety, depression, and because they hear the tinnitus, and then that in turn causes the anxiety, depression, and then they hear it, it makes it worse. And then back around, the stress and anxiety exacerbates tinnitus. So it's like a cycle of like, so any way that we can get out of that vicious cycle is going to be the very best. One thing that I always recommend the hearing test, to see if there's hearing loss. Oftentimes, the tinnitus is a symptom of the hearing loss, but we do know that there's no cure for tinnitus, but there's several treatment options. Hearing aids are an option. Sound therapy is an option. And I always tell my patients, it's not so much of what you're listening to, it's how you listen to it. So if your tinnitus is, let's say, an arbitrary 7, you never want to set the volume of the sound that you're listening to a 7, 8, or above that. Because as soon as you set it to that level, when the sound goes away, the brain says, oh no, we lost a whole bunch of sound. Then it picks up the amplifiers, and then that makes it worse, potentially. So I always tell patients just to pick a sound that is beneficial to minimizing it, such as brown noise. That's been very popular with my patients. Lower frequency. Are you referring to hearing aids, or just even on an app? An app. They can do that on an app.
So I guess you can get brown noise on YouTube, can't you? So that's easily accessible for most people.
You can also download hearing aid apps and not necessarily have the hearing aids. It'll obviously just come through the speaker of the phone. Do you guys have a lot of Amazon Alexa users?
Yeah.
Sometimes you can have Alexa play things for you. But we're gonna one app that you might want to recommend is by a manufacturer. I think it's a Danish manufacturer called Widex. WIDEX. Those are also the hearing aids that we recommend as well. Especially if there's hearing loss, the patient really ought to consider hearing aids coupled with all this other stuff. But if there's no hearing loss, even patients with no hearing loss will get devices just because they want them in their ear throughout the day. But if, let's just say there's no hearing loss, they don't want to deal with devices, and they just want some sort of sound therapy, let's say through an app. The Widex, it's called Widex Tinnitus Management. Widex Tinnitus Management. Just not the Widex, I'm hearing it on the. Oh, Zen is good. Oh yeah, that's it. Widex Zen, ZEN. And then I think the rest will come up as Tinnitus Management. It'll be in the Play Store for Android and in the Apple Store for iPhone users. I believe the color of the box is blue. Yeah, and it has a ton of different sounds, sound options. You can set it to turn off after a couple of hours. There's a timer on it. There's relaxation exercises. Because I myself, especially in the past year and a half, 2 years, but 2 years now, get intermittent tinnitus, and it is the scariest thing. I just can't believe, I can't believe I'm getting this. I can't believe it's happening to me. And it does go away. Once it lasted 6 hours, I was practically calling her, freaking out, because it's just scary. Even for somebody who knows that it's not the end of the world, it feels like it is, because it is safe. It's like, it's in your head, it's an awful, I don't know, we call it affliction. I hope that they come up with if you will, a permanent cure for it someday. But again, there's a lot of things that you